Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Let's coming back to the class now. Let's start with first just the cysts. Okay, so there's a female who's around 62 years of age, and she comes to you with let's say bloating. You ask her to get an ultrasound, and there comes a cyst. All right. Now, in my last class, I told you very, very important aspect, because I knew that the next class is going to be so much, stuff is there to be talked about in the next class, that probably this thing I'll not be able to take in so much detail. The most important aspect when you get an ultrasound done for this patient is going to be whether this mass, the cyst, this ovarian cyst, is malignant or is it benign. Right? So all those tests which you need a CA-125, you need a TVS scan, and then finally you sit down and do the RMI scoring, and you get to know whether this is now a malignant mass or a benign mass. Now the scorings are the M rules, the B rules, the IOTA scoring, everything I have taught in the last class, which was actually a class on germ cell tumors, but I called it as this is ovarian masses in postmenopausal females. I called it ovarian masses in the premenopausal females. Okay, so because whatever confusion students could not be able to understand, so this time I had to call it ovarian carcinoma for them to understand what exactly my emphasis is going to be on. So if suppose there is a cyst, just a cyst that comes, right? So first of all, obviously this is how you kind of diagnose. How do you get to diagnose it? So I just gave you one scenario. There could be so many other scenarios. It could be absolutely asymptomatic. Okay, it just by chance, you went in for an ultrasound. There are patients who come to us in menopausal clinic and he would tell that, ma'am, I came for a normal general checkup and I want an ultrasound. So asymptomatic female going for an ultrasound and suddenly a cyst comes there. Or a patient who comes to you with acute pain, torsion, hemorrhage, rupture. Okay, acute abdominal pain could be a presenting symptom. So what do you do for them? You ask them for an ultrasound. So it's either on the TVS that you get to know, and once you get the TVS to know that, oh, it is an ovarian cyst, the second thing is CA-125. So these are the two recommended tests for ovarian cysts in postmenopausal females that are initially, I'm using this word initial assessment. MRI, CT scan, they are not essential, initial assessment tools. PET scan, not an initial assessment tool. So don't be surprised when these slides are going to come next. So a thorough medical history should be taken from the woman with specific attention to risk of, what happens is that when a patient comes to you, okay, with a cyst, obviously you have first taken the history and then gone in for examination and for the tests and stuff. But what exactly are the questions to be asked in the history for a patient who's come to you with an ovarian cyst, or she's come to you with an ultrasound diagnosis of elsewhere, and she comes to you with a cyst? So what all questions would you ask? See, like I told you, what history are you going to ask, and how examination are you going to do? This was a undergraduate level question. Okay, now the questions that are going to be asked to you will be diagnosis and management at the postgraduate level. Remember that always. Okay, that's a funda you should know. By now, I expect you to know this much. Okay, all those students who've taken my practical classes know this very well. So as far as examination and history is concerned, that is a question of the undergraduates. All right, guys. So if you see on YouTube, there are many, many. I was, exhausted seeing so many videos on practical case discussions. Of course, for gynae were also there. But unfortunately, you'll end up seeing a video for 1.5 hours, learn the video and learn things from there. But it will not be of a benefit to you because they have not mentioned this thing, that this was a Viva of an undergraduate level. So I've seen, people going on and on about the history. Very good, very explicit history, beautiful points, very valid points that have to be asked, but not required at your age, guys. You've grown that stage. You've already outgrown that stage. For you, history is important, but to a very, very minimal extent. Have you ever seen in your practical Viva, have you experienced it? I'm not talking about, obviously you've not been through the main Viva, but the Vivas that, your mentors might be taking in your colleges. They stop you in the history many times. And they say, fine, jump to the diagnosis. Why? Why? Because it's understood that at postgraduate level, you are expected to talk more about diagnosis and management and follow-up, not about the history and examination. All right, let's not go further from here. Let's just focus ourselves to what medical history are you going to ask. Very important in ovarian carcinoma is a family history. Obviously, you'll be asking, have you experienced any late symptoms in your maybe a bloated abdomen or decreased appetite or feeling of fullness or indigestion on and off, and you should be able to ask whether she's feeling in any which ways uncomfortable since she was before, bowel bladder habits have changed or not. And the most important thing, as you can see, family history of ovarian or breast or bowel cancer. These three, they go together. What do you call that? A combination of these three, what do you call that, guys? I think I just speak to you in the last class, didn't I? Guys, can you not hear my voice? Please quickly tell me. Deepa is telling me that you can't hear my voice, is it? What's going on, guys? I have a good network. Lynch syndrome, absolutely, absolutely. That means my voice is there, all right? Lynch syndrome it is, absolutely. So where family history is significant, you have to refer to the regional cancer center. Deepa, can you hear me now? Appropriate tests should be carried. Appropriate tests should be carried out in postmenopausal women who has developed symptoms within the last 12 months. Very, very important. You have to take, see, ovarian cysts in the postmenopausal female have to be taken up very, very seriously, guys. Okay, you cannot jump that. You cannot, ignore that. You have to take them up very, very seriously because ovarian carcinoma is the most notorious of all the cancers. Okay. So physical examination, very, very important because that will tell you half the, stuff. Suppose it's a big cyst, then you can find out the borders. You can feel the, whether the cyst is cystic or solid, whether it's moving or not, the mobility is there, what is its, whether it's tethering around with the surrounding structures, whether there is fibrosis, so many things you can find out. Okay, so of course in the situs. And whether there's any pleural effusion, the lungs are involved or not, because then you will be hearing hoarse sounds. Not exactly because of pleural effusion, because of so many other things. But yeah, that rub and pleural rub would be there. Anyways, now CA-125 should be the only serum marker which is used for primary evaluation. Remember, though CA-125 has its own flaws. I'll get to that. Like I told you, I'm going to talk to you regarding the problems with CA-125. But not as a screening tool, as a marker in the primary evaluation. Now you know that this is and believe me that even if CA-125 comes low, you cannot totally rule out that it's a benign, it's not a malignant case. Like I told you, CA-125 is sometimes low in early stages of ovarian carcinoma. So it's there. Stage 1 carcinoma is there. She can be operated right now and she's a good prognosis, but right now the CA-125 has come so low that we are presuming it to be just an ovarian cyst and we'll go ahead and do just oophorectomy and we'll be happy with it. Okay, we might not, look around to a proper staging laparotomy, but I'll tell you how and when it has to be done. Okay, now, right now we're talking about just a cyst. Okay, it's just a cyst which we have seen in the ultrasound. Okay, we are not talking yet about it being malignant or it being benign. We are just still trying to figure out whether it's benign or malignant, but the age is very, very categoric for it to be a malignant mass. And if in case it's a malignant mass, we do not want to ignore it. So CA-125 should not be used in isolation to determine if a cyst is malignant or not. While a very high value may assist in reaching the diagnosis, a normal value does not exclude ovarian cancer. Very important. So it should not be used in isolation. That thing I wanted to impress upon you. Okay, and there is no currently sufficient evidence. So there's so many people who get done, the CA-99 and CEA and CA-72. So these are the things that get done, but actually there is no evidence to support any use of these tumor markers.